In the interest of time, I'm going to try to go through this slide set very quickly. I just wanted to say, I'm not sure what senior staff member means. I don't know if it's related to age or how long I've been there. But anyway, this talk actually got started because we do a lunch and learn session for patients and their families. And I did this in July of last year. And what was interesting is the talk actually was a 1-hour talk that went on for 2 hours. It extended on into the part of the, or after the conference was already over. And so there's a lot of interest in patients in complementary and alternative medicine. My disclosure slide is here. It does not affect what I'm going to be presenting. And some of the complementary therapies I would say would be off-label indications. Now, what my objectives are in this talk are listed here in the slide, and this is also in your packet. It's to define complementary and alternative medicine and define more so its significance in our oncology patients. I'm going to review the subtypes of CAM, or complementary and alternative medicine. I'll use the term CAM during the presentation. I'm going to update evidence-based data that supports or refutes the utility of CAM in symptom management in cancer patients, and update evidence-based data that supports or refutes the safety of CAM in symptom management in cancer patients. Now, most of what I'm going to talk about is from our Multinational Association for Supportive Care in Cancer meeting in Copenhagen, where they had a 2-hour session that had multiple speakers, and I'm actually trying to distill what they talked about in a short period of time in a few slides, which are actually in your handouts. One thing I want to point about, I want to put in a plug for Multinational Association for Supportive Care in Cancer. It is an international group that we look at trying to further research in trying to help patients actually live better in dealing with their cancer, either at diagnosis or after diagnosis. And I want to point out, it says supportive care makes excellent cancer care possible, and that's what we aim for. So it's been a very interesting group for me, particularly the international flavor, where we can get ideas from folks from other countries that help us learn how to do things in our own country. And I'm going to acknowledge the speakers at this meeting, and this is on your handout. Now, what are the things that come to our mind as clinicians when we talk about complementary and alternative therapy? Well, as you can see, skepticism, controversy. Some people get outright hostile when you talk to them about CAM, either if they want to take it or if we don't want them to take it. Clinicians, we look at it sometimes as unscientific, clairvoyance or a psychic medium, mysticism. And a lot of folks say, well, because it's natural, it's safe. Well, in our country, we really don't have any skepticism or controversy in the United States, as you know. So actually, it's really interesting. I got this slide, and I found a lot of commonalities here that were in this presentation. But the one thing I do want to say is distress. One of the speakers at the meeting actually talked about where's the science behind complementary medicine. They called it Mickey Mouse science, is what some people think about complementary therapies. Now, Dr. Charalambous actually talked about the conceptual misunderstanding we have with CAM in general. We say CAM, complementary and alternative medicine, but when you really look at it, we're really not talking about CAM. What's interesting is we all talk about that CAM is not the same thing as complementary medicine because it's different, as shown on this slide, but we tend to use CAM because it's easier to say. But when we talk about CAM, CAM is not considered to be mainstream medicine. It most often is not included in public health systems. But dividing it to the conceptual misunderstanding is complementary is an adjunct to mainstream care to improve the quality of life, decreasing the adverse effects of anti-chemotherapy treatments or anti-cancer treatments through alleviating the symptoms of cancer, through improving the general well-being of the patient. Whereas alternative medicine is generally promoted and used as a term when we talk about agents that are not approved, that are used as anti-tumor treatments themselves. The NCI has a definition of CAM, and it's basically standard treatments that are based on scientific evidence of research studies. So it's an evidence-based process according to the National Cancer Institute. Again, they confer complementary medicine as treatments that are used with standard medical treatments, not as an exception or as an alternative. And it's like using acupuncture is an example of that. Alternative medicine they consider as treatments that are used instead of standard medical therapies. And one thing we're going to talk about toward the end of the talk is how do we bring all this together? There's a new field called well, that's probably not new, but it's something that we're kind of using the term integrative medicine, where we take complementary therapies and integrate it with standard medical therapy. Well, what are the types of CAM? What are the types of CAM that we see? And they're listed on this slide, and this is in your handout. But acupuncture, homeopathy, herbal medicine, vitamins, minerals, diet, nutrition, hypnosis, guided imagery, and a number of the energy sort of therapies. These are all here. Massage, we're all familiar with that. So why do we want to talk about CAM? Well, CAM is something we're not able to avoid. And when I first became interested in CAM, it was interesting to me that patients CAM use may be more so than we actually as clinicians think is actually going on. And this is kind of a distillation from the conference, but you can see that CAM use in these patients in these particular studies can vary anywhere from 7 to 64% in one study, up to 33% in another study. But the bottom line is a large majority of our patients with various cancer types, and even in the pediatric population, are taking CAM. In this study here, the CAM was used predominantly in non-cancer methods as nutritional supplements. Spiritual healing and prayer is felt to be complementary therapy. Megavitamins, herbal supplements, chiropractic was also considered to be complementary therapy. And the uses predominantly are in arthritis and chronic pain. This study here showed that in cancer patients, about 55% of patients were using CAM. So it kind of varies as to which study that you look at as to how frequent the use of CAM is in our patients. Well, when Dr. Charalambous was doing his talk, he says, let's let the numbers do the talking. And CAM is a significant part of our healthcare system, whether we like it or not. And the numbers do the talking. In this particular study here, the CAM use from 1990 to 1997 increased 25%. The herbal therapies went up 380%, high-dose vitamin therapy 130%, and visit to CAM providers of 47%. It's 427 million versus 629 million, I believe that's visits per year, but I'm not sure about that. But the total out-of-pocket expenditure is quite significant. $27 billion, which they state is comparable to the total out-of-pocket cost for all physician services. So we have to admit that CAM is a part of our healthcare system. The users that usually predominantly use CAM are listed on this slide, and they're usually female patients. They're usually younger with a higher education and a higher annual income. Now, what's interesting is at this conference, they talked about, are patients really getting from CAM what they think they're getting from CAM? And this slide here, I think it's in your handouts. It's a little hard to see. But basically, if you look at the first two caveats here, these patients, the reason for using CAM in this percentage of patients to directly fight the disease and alternative therapy and to decrease the tumor size. And you can see 16% of patients use that as the reason for using CAM. Only 3.9% of those patients experienced any benefit. So what they're using CAM for is really not being successful in that setting. Also to point out, they want to use it to increase the body's ability to fight the cancer. 50.7% found that as a possibility or a reason for using CAM, and only 22% experienced a benefit. What's also important, and I think is part of later slides that I'll show you, is to improve the physical well-being is another reason for using CAM in about 41%, and to improve emotional well-being in 35%. And what's interesting is those patients did tend to experience a similar benefit to what they expected. So it appears as though, looking at this, that CAM's actual biological effect may not be equal to the emotional effect, and some of this may be related to some of the psychological and well-being sort of issues that we look at. Now, one thing I want to point out on this slide is once again reiterating a diagnosis for CAM that's not on mainstream medicine. But the point is why does everybody seem to be wanting to use this medicine? Why are the percentages so high? Well, it was felt in this study, I thought this was pretty good to say it's a demand that's not really met by our orthodox system of medicine. So that may be a reason. And Dr. Molassiotis, who's a very renowned researcher in CAM therapy, had some very, very good observations during this meeting. And he calls them factors that push people into using CAM and the factors that pull patients into using CAM. He called them the push-pull factors. And on the push factors, as we can all admit, we do not have curative treatments for all types of cancer. We also can admit, and basically based on our other presentations, there are adverse effects from orthodox treatment. I think this is one big process, is there's a lack of time in our current healthcare system with practitioners and the loss of bedside skills. There's a dissatisfaction with a totally technical approach to malignancy treatment, and then there's a fragmentation of care that we see in our healthcare system from specialists. And that's outlined on this particular slide here. If you look at, this is a slide that I used to talk about the way medicine is changing, and you think of Hippocrates with the physician at the bedside has turned into a doctor, and he's got Dr. IT on his cap here. He's got a stethoscope attached to his computer. He seems to be spending more time with his computer than he does with his patient. So it's no wonder that patients may perceive that there's not the type of care that they would like to see. And for that reason, they may want to take things into their own control using CAM. The pull factors is there's a lot of media out there for complementary therapy, and also a lot of folks believe that because it's a natural therapy, that it's a therapy that is going to be beneficial for that reason. I think one of the main reasons is it gives patient empowerment, focusing on spiritual and emotional well-being, which we talked about on the other slide. The 3 T's, Dr. Molassiotis brought up the 3 T's that, again, going back to our current healthcare system where we see high volumes and don't spend much time with our patients, some of this is the 3 T's of healthcare, the touch, talk, and time. And that's something that I can improve on in my own practice. Also, just the healing environment and the physical setting can also make a difference as far as complementary therapies are concerned. And this is just part of this came out actually when I accepted to do this talk. This came out in the National Geographic about nature's remedies, again looking at complementary therapies as natural. Now, when I first ever heard about CAM, I was getting ready to get out of medical school. And I don't know if any of y'all know who this is. This is Steve McQueen, who was a renowned actor. And what I heard at that particular point in time is that Steve McQueen had cancer. He'd gone to Mexico to get a drug called Laetrile, which was kind of the going thing back then. And he ultimately died of his disease. It's interesting, his legacy of Laetrile, it was basically, he had to go to Mexico for unorthodox care. The medical profession largely derided McQueen as a victim of fraud, but to some people with cancer, his pursuit of alternative treatments was felt to be heroic. What lessons do unconventional therapy or journeys like this provide for us today? So just bringing that up, the one thing that I noticed after looking into this a little bit, I'm not sure, there's still a little controversy about Steve McQueen, but the main point was Laetrile was brought up at that time, and Laetrile has been shown to have little anti-cancer activity in animal studies and no activity in human clinical trials, has a significant amount of side effects, and is not approved for use in the United States. And to bring that up, the New England Journal of Medicine published an article, and what was very significant about this article is there was no medical benefit, and in fact, these patients who took this drug would develop elevated levels of blood cyanide, so it was a very toxic drug. And so, but you kind of see what people will do if they have an incurable malignancy. A lot of times they'll seek therapy that is not orthodox therapy. Also, we know that certain complementary therapies can interfere with the effects of chemotherapy. And this is from the British Medical Journal talking about St. John's wort interfering with chemotherapy based on its effect on the P450 system and interfering with metabolism. So there's evidence that it may actually be harmful. Kava is another drug that has been used to treat stress, anxiety, tension, and sleeplessness and problems of menopause, but it has been shown also to have liver disease. So these are just some examples of agents that have been used, but the point is there can be toxicity and there can be problems with using these medications in these patients. So the healthcare professionals' concerns about CAM and cancer, they have potential to interfere with the outcomes of conventional cancer treatment. And it lists a number of these here, and I think this is probably also in your handout too. But antioxidants may interfere with the outcomes of cytotoxic conventional medical treatment, radiation and chemotherapy, and some endocrine therapies. Like we just mentioned, cytochrome P450 pathway can be altered, and it can delay excretion of drugs, the metabolism of drugs, and so it can cause increased toxicity or lack of efficacy. There's also a concern that some type of natural agents may have hormonal type properties and may be contraindicated in hormonally sensitive cancers. The ones that modulate the immune response are not recommended in hematologic malignancies. And also one we forget sometimes is some of these have procoagulant effects and alter the bleeding time. So they also can have other side effects. And I've seen a number of patients in the clinic that are on complementary therapies and have a number of side effects that are unexplained, and they may be on a number of these complementary therapies, and we're not really able to tell whether it's disease recurrence or whether it's other symptoms or whether it's the complementary therapies themselves. So it's really hard for patients to make the right or know which way is the right way to go with these particular agents. Well, this was an interesting quote from, a lot of folks, and particularly when I first started hearing about complementary therapies, I was rather skeptical, and I was of the type that said I thought that was just kind of trial and error science. And so this is actually Thomas Edison who invented the light bulb, and he had an interesting quote. He said, "I have not failed, I've just found 10,000 ways that don't work." But he ultimately found something that did work. Well, in science, we're not inventors, we're clinicians and we're researchers. What was interesting, I found a quote on him yesterday that says, "My desire to do everything within my power to free people from drudgery and create the largest measure of happiness and prosperity." And I thought that was interesting because he almost sounds like a supportive oncologist. So what's the solution to all this? Well, my answer would be keep calm and use the scientific method. When all else fails, let's do the appropriate science to evaluate these agents because, some may have benefit. And this is a slide I think that's also in your presentation, and it looks at a number this kind of distills again all of the studies that have been looked at, but predominantly one of the investigators that was doing the studies, doing a meta-analysis review of CAM therapies, a lot of folks say, well, there's no science behind CAM. And she brought up a good point. She said that I did a literature search looking at complementary therapies and put in the word neoplasm and got 9,700 hits just with those two terms. And so there are studies that are available, but the question are, do these studies really show benefit from CAM therapy? And on this slide, what you can see is there has been studies that have looked at a variety of symptom types, including emesis, pain, fatigue, hot flashes, xerostomia, dyspnea, and anxiety. And this study here was reviewed, and it actually showed that acupuncture was beneficial in this particular study. And if you look at this slide, you'll see acupuncture, mindfulness-based stress reduction, guided imagery, a certain integrative modality, and guided imagery. These did have an effect on certain parameters to improve quality of life. Now, the speaker, Johannesen, presented a systematic review of CAM, And basically, just to be brief about this, what she did is she took a review of 163 studies. And the studies were looking at a variety of types of CAM, 5 with manipulative and body-based therapy, 15 with energy medicine, 25 with mind-body therapy, 80 with biologically based practice, and several forms of CAM. What they did in their study is they looked at the type of therapy that was being given, what effects were the ultimate outcome that was being studied, what was the quality and strength of evidence on the effects, and what were the safety of these agents, and what treatments were not investigated. And basically, in their study, they studied these particular agents as part of the biologically based practice. And I'm bringing this up here. I was actually talking to Dr. Barton after her talk, and they did not include ginseng in this particular study. And that's important to understand because of the conclusions they're going to come up with the study. And see, what they did is they took a variety of levels of recommendations and then what symptoms and therapy were used. And a level A or B recommendation showed that there was enough data to support the use of those therapies. I didn't put all those slides up here, but for example, acupuncture and hypnosis were predominantly A's and B's. Whereas if you look here, the biologically based practice, most were C and D's, and they felt that below the level of B, there was no scientific evidence that it was proven beneficial. So ultimately, her conclusion was that there was no evidence for positive effects of any biologically based practice. Other conclusions from this systematic review showed that massage reduced anxiety, acupressure reduced its chemotherapy-related nausea, and hypnosis was quite impressive to reduce anxiety and pain and had a positive effect on coping, mood, and quality of life. Also, they say many patients subjectively experience a positive effect on these and other CAM therapies. And I think that's important because the word subjectively, and that's kind of what I alluded to when I talked about the emotional response to CAM therapy. Now, what is integrative oncology? Integrative oncology incorporates complementary therapies that are rational, cost-effective, non-invasive, and evidence-based. It's empowering as it allows the patients to assume an active role in their care by combining evidence-based complementary therapies with standard therapies. And one other point that was brought up is that it eliminates the statement that, well, you're looking back on your cancer, if I'd tried this, things might have been better. So it gives patients a little more empowerment over their choices of therapy. This is just an example of one case, the use of ginger in the treatment of nausea. This is actually a picture of a 4-pack of ginger beer that one of the patients brought to me after my talk on the complementary therapy, and it's actually pretty good. And it's not beer, it's got ginger in it. But anyway, I was looking for literature, and there are literature that would support the use of ginger for nausea in cancer patients, although I will tell you a couple of studies didn't support its actual benefit. So how do we integrate CAM into clinical practice? Well, I think the main thing is to use the scientific method. In other words, when we come up with an idea, we do a hypothesis generation, we evaluate that hypothesis, and I think what happens with some CAM providers, as we all see in our clinics, is the CAM providers will come up with an idea and they go right into treatment with the idea. And so in a scientific community, we need to go through the ability to evaluate and ultimately to be able to look at these agents' work with evidence-based medicine, accept these, and ultimately integrate these into the system. Now, one of the speakers, and it's actually cut off by this little bar there, but a Dr. Levin from Calgary actually presented one of the presentations, and one of the points of this talk is the way we can help our patients is to be educated more about CAM. Because I think what we're hearing is they want some input into their health care, And if we don't know what to tell them, I mean, a lot of folks, I've heard them say they go to their doctor and they say, I've got complementary therapy I want to try, and he said, I don't want to talk about that, and they walk out of the room. And so that patient may be likely to go out and use that therapy, knowing the statistics that I've told you. So what this here, and this is actually a free service, if any of you want to get on this. I apologize, I think on the next slide I have the address, but I've actually taken this study, and it's a study where they looked at a survey of 481 cancer patients and 100 healthcare providers, and they found that 80% of patients had no discussion of their healthcare provider about CAM therapy. They found that 15% of healthcare providers appeared to be knowledgeable about CAM, and 97% were not prepared to monitor CAM if a patient was going to take the complementary therapy. And so what they did is this is the website right here, CAMEOprogram.org, and it's a three-module online session that is geared to increase the knowledge of healthcare providers, to change attitudes, and improve clinical practice. And what they found in the study is that there was increased complementary therapy information seeking and evaluation skills that were implied in this particular study, and healthcare practitioners' knowledge base was increased, healthcare clinical practice with complementary therapy. These were things they were trying to imply from the study. But what they wanted to do is they felt that improving the education and knowledge would ensure patients receive reliable and accurate information about complementary therapy. It doesn't mean that we prescribe complementary therapy, but it's just being able to talk to the patient and know how to answer their questions, and to provide them some direction on decision support and improve health and well-being and avoid potentially harmful effects of misused complementary therapy. Dr. Molassiotis, I'm going to use his observations as kind of my conclusion about the meeting reports and what was finally concluded at the meeting. Basically, it was felt that the use of complementary medicine or alternative medicine, just because the patient demands it, he did not feel that was a good reason for using it, and he strongly discouraged that. And I have to go back and give a caveat too. These folks that were presenting are all complementary medicine providers or researchers. So they actively utilize these processes daily. He felt that CAM needed to be evidence-based, and that we need to look at our research and methodologic problems with doing research with CAM. When you look at the studies that were reviewed, there was a lot of flaws in basically the way the studies were set up and or the conclusions that were made. So we've got to improve our methodologic problems and develop and refine those. No more surveys of CAM. Basically, he felt we needed to have qualitative reviews only. In other words, it's not important anymore to know that 63 versus 70, 33% of patients use CAM. The bottom line is CAM is here, and we need to try to better understand it in a research setting. We need more accurate information, and integration into clinical practice may be appropriate, and also looking at CAM as not a single entity. CAM includes the complementary therapy part and the alternative therapy part. His proposal was instead of using the word CAM, we should use the word acupuncture or massage, and not just lump all CAM therapies in together. And then also, from the basic science sense, trying to understand how CAM works. And then also to work with CAM providers and integrative therapy providers in trying to work together rather than in isolation. And at least in my career, I know I have personally tried to not work really closely with any CAM providers. So how do we approach patients who bring up CAM in the office? And this is just kind of the way I open it. I call it, how do we approach them? It's with the how technique. The how is honesty, open-mindedness, and willingness. The honesty is anecdotally evidence. Anecdotal evidence is not always worth the risk. If somebody tells you they can roll you across Niagara Falls in a wheelbarrow and they just did it with a bunch of bricks, are you going to be the next one to step on the wheelbarrow? open-mindedness, and this is a quote from Carl Sagan, and I think it's very interesting because the absence of evidence is not evidence of absence. So I think being open-minded that CAM may have a benefit, but that then comes in something that we've talked about. Dr. Barton was very kind to do a research seminar for us, and we talked about qualitative and quantitative evidence. And qualitative evidence can be very important, and that was brought up in this meeting also. And I'm just going to show you a couple of slides there. Manipulative and body-based medicine was really a level C recommendation in that particular discussion. But one of these patients said, it was the first time literally in years I was able to relax and become de-stressed, and I know that I can honestly say for the first time in 4 years that I feel good within myself. So did that patient have benefit? Energy medicine, another topic in this particular study. Several quotes were made out of this study where the patients actually, this is qualitative evidence, but I felt all the way to my toes that something had happened and that everything relaxed. I felt protected. I'm here with you. You're not by yourself. I got to that stage, very, very light, not like sleeping. It felt like streams, bubbles, and waves as a contact that was turned on, peace and radiation. So we've heard other speakers talk about the distress that cancer patients go through. That's something I would like to hear my patients say. Now again, the evidence base on this so far has been not to the level where we recommend this type of therapy, but the point is there may be some qualitative value in what we do. The willingness is we need to be willing to research this area. And this is from Dr. Molassiotis' slides also. A biologically plausible mechanism exists, and research plausibly lead to the discovery of biological mechanisms of disease and the treatment effects. So looking at the biology behind what CAM therapy may be doing. Also looking at conditions that are highly prevalent, such as fatigue, a condition that can cause a heavy burden of suffering, so we need to look into those. The potential benefit being great. Some evidence already exists that the intervention is effective. Some evidence that there are safety concerns or risks need to be taken into consideration. And the research design needs to be feasible and is likely to yield an unambiguous result. And I think that's where we can improve in our research in this particular area. And the target condition or the intervention is important enough to have been detected by existing population surveillance and mechanisms. And then we need to have phase 1, 2, and 3 trials on these particular agents if we're going to use them or research them more. So I would like to conclude by just saying that the next meeting of MASCC is in Adelaide, Australia, and it's a very good conference. I don't know if folks can go all the way to Adelaide, but joining MASCC is something I'm glad that I did because it gives us access to international input on how to deal with cancer patients and the symptom management. But I also bring that up as supportive care brings out excellent cancer care in patients. And one way we're doing this at the Mitchell Cancer Institute is we've actually have an endowment that we've set up for supportive oncology. We're trying to build up funding so we can do some of this research because funding is very difficult. But I think it's very important that we do research in supportive oncology to try to help our patients because after all, a good life for our patients is what we're aiming for. And thank you very much for your attention.